All set. Great. Yeah, I think Lisa, whenever you're ready,
Okay,
get started.
sounds good. So everyone, my name is Lisa Garso. I just want to personally welcome you to clinic on behalf of the RCM team. We're super excited that you decided to join us today. We have a lot to talk about and I'm going to go in and get started. First, I'd like to introduce you to the team. So the RCM team is a dedicated group of professionals specializing in credentialing, provider enrollment, billing, compliance, auditing, insurance eligibility, all things revenue cycle. Today we handle all aspects of the revenue cycle management, full revenue cycle. And this is new for clinic, so we just brought revenue cycle in-house. Previously, this was with a vendor, and we're super excited that now we own the whole process from beginning to end. So, like I said, my name is Lisa Garso. On the call with us today, we have Anna Cruz. She's our credentialing enrollment specialist. Christine Dixon, she's also our enrollment and billing specialist. Icy Castro, unfortunately, she wasn't able to make it today, but she is a medical billing specialist here on the team. Tracy Crosby, medical billing and compliance auditor. And then coming soon, she's going to start with us Monday, our newest team member, Christina Brosk. She's our insurance eligibility and medical billing specialist as well. So with that being said, I'm going to hand it over to Anna.
Okay, so this is the onboarding overview. So it's listed, it's just going over what we need when you guys get to the process of credentialing and enrollment. We have to make sure we have all the documents like your licenses, your DEA, your liability. It can't be expiring within 60 days. If it is, please be sure it's updated immediately, because if it expires during the enrollment process, it will stop enrollment and we have to start all over again. The best way to do that is keeping your CAQH portal up to date. A lot of these insurance companies are going to verify your information through the CAQH portal. So it's important that you keep all of that updated and documents uploaded. And we will be sending you emails on what's going on with the process, or if we need anything, or to sign an agreement. So just please watch out for those emails. Like, these agreements will expire if not signed within a certain amount of time. Or if we don't get information missing to continue enrollment, then the payers will cancel the application and then we have to start all over again. So we want to avoid all that. And then if you ever have any questions, you can always email us and reach out, and we get back to you within 24 to 48 hours.
Thank you, Anna. And I think something to note here too, it's really important that we have the best contact information for you when you go through the onboarding process with our implementation team. And now Chrissy's going to tell you a little bit about payer enrollment.
Okay, and this basically is just kind of referencing what Anna just spoke of when it comes to the payer enrollment process. And this is with, all of these insurance contracts, is the reason why we need the licenses need to be updated for each state. And it's the same thing. If your license is set to expire within like 30 to 60 days, that will be an issue. And some payers do see that as a red flag to stop and wait for that to be renewed before they continue the enrollment process. It's the same thing with the DA registration. If they see that it's soon to expire, it's also a stop and it will lag the enrollment process. So it's very important to keep those things updated, especially when it comes to the enrollment process with the insurance companies. Depending on your specialty, collaborating agreements will be required. And depending on the state as well that you are practicing in. So we'll need that. And that is something that you would be collaborating with a clinic medical supervising physician. Board certification is very important. Some payers, if they don't see that you are board certified, it will delay, and depending on it could also affect like the networks and the payers that you get approved for. They do look at your CAQH portal is the reason why we ask you to make sure that it's updated, because once we submit that enrollment for you, they're going to get your CAQH number and they're going to go in there and they're going to look at all of like your resume. They look at your experiences. They're going to look at your credentialing background. So it's very important to keep that up to date. If it's not up to date, they'll come back to us and say, hey, come back when you're ready, basically, short words. You also Medicaid and Medicare enrollment. It's very important. With Medicaid, a lot of it is we do need your assistance. Being that we might need you to make us a delegate. There might be some certain forms that you may need to sign in order for us to continue that enrollment process with Medicaid. It's very important when we get to that process, email, and like when we email you, it's very to respond as soon as possible because they're time limited. So they'll give us like 5 days to get something signed. If not, we start over again. Medicare is the same way. We do need approval from you to actually start that enrollment process. Time wise, it depends. If you've never been enrolled with Medicare or Medicaid, it does take some time. So it also depends on your credentialing background and your experience as well. We also need access to the PICOs as well. If I'm not mistaken, there are some forms that you do need to fill out. So good email addresses are always good. If anything changes, let us know right away. This is the way we can get you credentialed, enrolled as soon as possible. I would say the time frame for enrollment can take up to 90 days. 30 days for if you already have some, like if you're already enrolled with Medicaid, we just got to link you. As long as you do your part, we can go ahead and get you enrolled as soon as possible and get you started as soon as we can. So.
Thank you, Chrissy. And yes, just to kind of touch back on that PICOS access, it's a connection request. Lots of requests. Thank you. And Tracy's going to talk to you a little bit about billing.
Great. So that's where I come in so you are starting to see patients and you're going to get an overview of our EMR, but the important things to remember are make sure you choose the correct template. So they'll show you all of those at onboarding. But that's one of the things that I notice a lot is that sometimes people choose the wrong template. I don't know if they're in a hurry or just forget about it, but they're clearly marked. And so please make note of those, because the reason that it's important to choose the correct template is when we go through an audit, we're looking for making sure that all of the proper documentation is there for submitting a claim. And the way that Jen has the flow of the template set up, we're making sure that everything is covered and everything is touched on. So when you choose the wrong template, you might be missing something. And so that could cause problems if there's ever an audit from an insurance payer. A very important thing is charts must be signed and locked within 24 hours of the visit. This is for several reasons, and one of them is the biggest, is that Medicare and Medicaid require compliance, that a chart has to be signed within 72 hours. We cannot bill a claim until the note is signed and locked. And they'll go over that with you also. One of the other biggest things is choosing the correct CPT code. And some of you might say, I've never had to choose a CPT code before. We've always had somebody who does it for us. We're trying to make it really easy. And we have on all of the templates, as you can see, there are little cheat sheets here at the bottom of every template for you to decide which is the appropriate CPT code that needs to be chosen. You can choose your CPT code based off of the total time spent with the patient. And please remember, total time means reviewing any lab, reviewing any past medical records, not just the face-to-face time with the patient. So that is total time. If you have to write any prescriptions, if you have to reach out to anything. So total time is everything that it happens for that patient, whether you're seeing the patient or not. And also one other item you're going to have to choose is level of decision making. Is it a low, moderate, or high? So when you have your time and you have time first, then you're going to have decision making right below that. Take a look at those and determine which is higher. Is 20 minutes with the patient who is a moderate decision making, that's going to be a 99214. You're thinking to yourself, well, why? You just told me 20 minutes. Because the decision making was moderate. So if you look at the explanations for the little cheat sheets, on the little cheat sheets, it's going to tell you. And that's important because we don't want to undercode. Should we ever get audited, we can get in trouble for overcoding and we can get in trouble for undercoding. So we want to make sure that we choose the proper code. If you're ever confused, you can reach out and say, hey, what code should I put? One thing that I do attend, the clinical medical open office hours, they're twice a week on Tuesday evenings and Friday mornings. I do attend those. So if you ever have a question about coding, you can come there. The even better news is that I audit every chart. So if I see that there is an issue with coding, I send you an email and say, hey, had to change the CPT code, just a reminder of what code it should be and what you're looking at.
Thank you, Tracy.
You bet.
That's such important information. So we just want to let you know that we are in this together. RCM wants to stack hands with the providers and make this process as easy as we possibly can for you. We want to be a good partner, and we need your collaboration in order to do that. So how can you reach us if you have any billing questions or the patient say that you're seeing has a billing question? Please don't use your time to try to talk about bills or statements. Please just refer them to us, and we can be reached via email at clinicalbilling@clinic.com. We have a phone number, the 206-973-3330. And any questions regarding credentialing enrollment, we can be reached at credentialing@clinic.com. Or just feel free to reach out anytime you have any questions, concerns, or any feedback for us. Like I said, we really want to be a good partner. Once you are onboarded, we're going to be with you every step of the way through, enrollment, re-credentialing, credentialing, expirables. So we want to make sure that we have a good communication and that we are here to support you. So I just want to thank you all for your time, and we're looking forward to working with you. Thank you.
Thank you, Lisa.
Thank you.
Okay.
Does anyone have any questions for us?
Not at the moment.
I do want to piggyback back on the enrollment. When you do get to the stage where your implementation is saying you're ready to start the credentialing enrollment process, we are going to send you a welcome email. And in that email, there'll be instructions on what we will need from you. If we're missing anything, it's all going to be in that email. So once you do get to that next stage, that's your cue to just keep an eye out on all communication with us, because that's when it'll start rolling in.
Yes, and just so you don't have to try to remember all of this, we will go ahead and send you a cheat sheet on how to reach us, who to reach out to if you have any questions. And then again, with Tracy's office hours.
This was helpful. Thank you.
Oh, you're very welcome. Thank you for coming.
Sorry about my little mishap at the beginning. Everything happens at once.
No problem.
Cool. Well, if nobody has any questions, we will, as Lisa said, follow up with some materials after this. And yeah, thanks again, everybody, for joining.
Thank
you.
you.
Have a great
Have a great
Thank you
weekend,
so
everybody.
much. Have a nice
Yes,
weekend.
happy Friday, everybody. Enjoy your
Thank you.
weekend.
care.
Happy Friday.
Thank you.
Bye.